What's up, Brad? Hello? Okay.
I can try doing that.
Hey, good. How you doing here? You know how the periapical screen, the login screen, and you won't get out of that. I tried to press the button 3 seconds on the Loma Linda text, what Don told me, and it's not getting out of that screen. I sent the screenshot to Dan Hahn, and I don't know how to get out of this periapical login screen.
Come on.
You know, Don Hahn is on the other line too, but I don't want to answer yet.
Oh, sorry. So we're going to go ahead and get started, and I am going to try to get this captured with Panapto, so we'll see how that goes too. Can you hear me? All right. Are you ready?
Yes. Yeah, sure.
All right. We're going to... And I think we're live. So do you guys have everything set up? We've got the PowerPoint open. All right. So our topic today is diseases of pulpal and periapical origin. And as a pathologist, I look at these a little bit differently than a dentist does. In a general dentist office, they are much more interested in lesions of pulpal origin and spend a lot of time diagnosing pulpal disease, doing electronic pulp testing, hot and cold tests, percussion, palpation tests, to determine if a tooth that either looks like it could have a pulpal problem or is symptomatic has a pulp in it that is still healthy, a little bit sick, or has passed the point of no return and has to have some type of treatment. I get a lot more interested in the lesions once they progress to the point where the pulp is dead and we have infection from that dead pulp that spreads to the periapical tissues. And we see those then radiographically. So that's going to be our major focus. That being said, there is one condition of pulpal origin that we will talk about, and then we're going to talk about all those other things where we have an extension of disease. When we have pulpal disorders that extend to the periapical area or not, they usually arise from caries. So we start out with decay in the enamel surface, and then from there it goes into dentin. If it is not addressed and treated at that point, the decay will reach the pulp. The first thing that happens when we have decay that reaches the pulp is it brings bacteria, and what kind of response is the pulp going to have when bacteria reach it? Acute inflammation, trying to control it. But the pulp has very, very limited resistance to that infection. So basically we get acute inflammation in the pulp and usually pain from the pressure because there's going to be exudation. And if something isn't done very, very soon, that infection will overwhelm the pulp. We have two diagnostic terms that we use for an inflamed pulp. We have reversible pulpitis and irreversible pulpitis. They have a little bit different symptoms. I let the dentist work those up and address those. Usually the hygienist isn't involved except to take a history of a toothache, because typically reversible pulpitis and irreversible pulpitis are symptomatic. Where we have to intervene with pulp therapy, not just treating the decay, is when we reach irreversible pulpitis. Because at that point, no matter what you do for the tooth, it's still not going to recover. And then the treatment for the tooth depends on the restorability of the tooth. If it's a restorable tooth, what we typically do is endodontic therapy and then restore the tooth. If it's not a restorable tooth, we extract the tooth, place a fixed partial denture, or maybe we go on to do an implant or something like that. But we do have to have some type of intervention. There are other conditions that can lead to irreversible pulpitis, trauma to the tooth, physical trauma, breaking a tooth, chronic clenching or bruxing. You can actually cut off the blood supply through the periodontal ligament space from clenching so long. Heat, thermal injury, you can burn pulp. We used to do that, placing gold foil restorations. So there are some other things, but most of the time our pulpal problems come through decay. If there is no intervention at the point of irreversible pulpitis, the next step is, we know from general path, after we go from irreversible, what's after irreversible? Pulp necrosis, absolutely. Pulp necrosis. And it is an extension of pulp necrosis that once it's dead in there, we actually end up with pretty much an empty space in the canal of the tooth, and that allows unopposed movement of exudate from the inflammatory response and bacteria into the periapical area. So that's how we get our periapical tissues. There is a diagram that shows your non-vital pulp, that means your necrotic pulp, where that can progress to a periapical abscess or a granuloma or a scar or a cyst, those kinds of things. But you should recognize that that progression of disease from the pulp to the periapical tissue, and we'll talk about that more in just a bit. The only thing that I do want to talk about that you're responsible for recognizing as a lesion of pulpal origin is a very unique response to pulpal assault that we see in immature teeth that have a large pulp space that's well vascularized, and that is chronic hyperplastic pulpitis. We typically see this in like mandibular first molars in children. What age does that first molar erupt? 6. Are 6-year-olds good at taking care of their teeth? No. Not usually. So first molar sometimes gets very large decay before it's treated. And because of that, we can actually have direct carious exposure of the pulp. And when it's a large immature pulp, sometimes we can get a different kind of response. Instead of necrosis, we get an attempt at repair, and we get granulation tissue, that primitive repair tissue that grows in the pulp chamber and out into the cavity space and into the oral cavity. Does granulation tissue have nerves? Granulation tissue, repair tissue, is made out of fibroblasts and endothelial cells making blood vessels, a little bit of collagen, not a whole lot. We actually get epithelium that grows over the surface, and we don't entirely know where that comes from, but it does. But there are no nerves in it, so we actually get this growth of tissue coming out of the pulp that you can touch and poke and bite on, and it has no pain or sensitivity response. It's living tissue, but it's not normal pulp tissue. Just because it's living tissue, can we leave it there? No, we still have to treat it. So recognizing that it comes from the pulp and not the gingiva that's grown into the huge cavity is an important thing. And the treatment, like any other tooth with pulpal problems, depends on the restorability. If it's a restorable tooth, we do root canal therapy and restore the tooth, and if it's not restorable, we extract. We like to save teeth whenever possible, but sometimes we can't. So that's our chronic hyperplastic pulpitis. You see the masses growing out of the big hole? Yeah, they're kind of interesting. Pink, fleshy, whatever. So that's our chronic hyperplastic pulpitis. Everything else that we want to talk about is associated with a necrotic pulp, where the assault to the pulp has passed the point of no return. It can't survive. It has died and carried infection beyond the pulp space of the tooth. Once we get infection that reaches the apex or maybe a lateral canal, you know about lateral canals, so sometimes the infection spreads laterally to the outside of the root, but usually it goes to the apex. Once it reaches the periapical area, the PDL and the bone surrounding the tooth, it reaches an area of tissue that has much, much greater ability to respond and control the infection. So usually it does not propagate unstopped once it reaches the periapical tissue. And because of that, we have kind of limited patterns of infection once we have the infection from the necrotic tooth that reaches the periapical area or bone. The 3 disease processes that you're responsible for recognizing on the basis of clinical symptoms and radiographic findings are acute apical periodontitis, chronic apical periodontitis, also known as dental granuloma, and apical abscess. The endodontists use some different terms that are based on symptoms that don't necessarily correlate with histology. And we as pathologists don't like that because we can't give those diagnoses based on tissue that's removed and submitted histologically because you can't see symptoms under a microscope. So our diagnoses are based on morphologic features, but they do correspond to the other. So there's asymptomatic radicular periodontitis and symptomatic radicular periodontitis and something like that. Yes?
You said within these 3 that it's necrotic pulp and it's seen within radiographs and...
So these are all diseases that are associated with a necrotic pulp. We do not get any of these unless the tooth is dead and infection is spreading from the pulp into the periodontal ligament space and surrounding bone.
But not the first one.
But
The first one that was...
acute apical periodontitis?
That's not necrotic pulp.
Absolutely, it's necrotic
Okay,
pulp.
it is. Okay.
All 3 of these are necrotic pulps. Absolutely.
Okay.
It's very important to recognize that.
Okay.
When we have a vital pulp, even when it's pulpitis, we do not normally see anything radiographically. There's one exception, and it looks totally different than the other ones. The conditions that we see that are periapical can go back and forth between asymptomatic and symptomatic, depending on the level of host response and control. So the patient can start with something very symptomatic, and the symptoms can go away, but then that can exacerbate and come back. So let's talk about acute apical periodontitis. This is a common pattern of disease when the infection first reaches the periodontal ligament space at the apex or the lateral root surface. Because it's very, very early, we often do not see any radiographic changes, and it's diagnosed on the basis of symptoms. Pulp testing that confirms that the pulp is dead, necrotic pulp, no response to electronic pulp testing, but very, very acute symptoms. So we have rapid onset of severe pain. It's localized to one tooth. It's worse with biting. So if they bite on it, you have to peel them off the ceiling. It can hurt to touch the tooth. Normally there's not any swelling detectable. If you see radiographic changes, the most you're going to see is slight widening of the periodontal ligament space. And that's because exudate is in the PDL and it's pushing the tooth up. The tooth is super erupted. When they bite on it, that pushes it back down into position, squishes the pus, creates pressure, and that's why they feel the pain. Does that make sense? So predominantly this is diagnosed on the basis of lots of symptoms, necrotic pulp, but no radiographic findings of significance. Does that make sense? All right. Treatment is to establish a pathway of drainage for the exudate that's reaching the periapical tissue. So usually the dentist will open the tooth, leave it open to drain. Occasionally they'll use antibiotics. The trend these days is not to use antibiotics, so just leave it open. When it quiets down and it's not quite so symptomatic, which literally takes a couple days, then they'll proceed with root canal therapy or extraction. When the tooth is very, very symptomatic, they don't usually even want to do same-day extraction if the tooth is not restorable. You really want to wait until the symptoms settle down. Is there a reason for that? What do you know about local anesthesia when there's a lot of inflammation? It doesn't work very well. So if they try to numb the tooth to take it out, it won't numb very well, and the patient is suffering more. So it's better to establish drainage and get the tooth quieted down, and then do the extraction when you can get, or root canal when you can get really good local anesthesia. So that's our acute apical periodontitis. We have a lot of dental phobes out there who will put up with a really bad toothache rather than go see the dentist. And so we can have a transition from acute apical periodontitis to chronic apical periodontitis. And that transition means the symptoms disappear or are absolutely minimal. Slight discomfort to biting, but no overt extreme pain. Don't have to peel patients off the ceiling. What do patients think when the pain goes away?
It's gone.
Oh, the problem is gone. Oh, good, I don't have to go to the dentist after all. Guess what? Sometimes we get periapical infections that extend from a necrotic pulp that bypass that acute apical periodontitis stage and go directly to a chronic infection. And they never did have a toothache. Isn't that interesting? It goes both ways. Chronic apical periodontitis is the most common periapical pattern of infection that we see radiographically and clinically. And because it is not symptomatic for most patients, it can be a surprise that they have periapical disease, and they might be a little bit resistant to treatment. Because they don't have a chief complaint, this is something that you might pick up on radiographs when you're treating patients. And anybody that's part of the team that draws attention to a problem to the patient, increases their awareness, and reinforces the need for treatment, will help the patient accept treatment better. Because patients don't like expensive treatment like root canals when they don't have a tooth that hurts. I've worked with dental students for a really, really long time, and my dental students are really, really bad at diagnosing our chronic apical periodontitis and proposing appropriate treatment, because they too buy into, well, if it doesn't hurt, it doesn't need treated. And that is like total baloney. This is an active infection. Just because our host response is keeping it contained doesn't mean it doesn't need treated. It's still an active infection and has to be treated. Furthermore, I have seen dentists restore the tooth and not treat the periapical disease and pulpal disease. And what do we call that? Malpractice. Absolutely. That does not meet the standards of care. So it doesn't matter that it's asymptomatic. You have to treat it. So clinical features for our chronic apical periodontitis are usually no clinical symptoms. There will be obvious signs of caries or traumatic fracture or something like that. There's going to be a problem with the tooth, maybe huge recurrent decay, but we have a radiographic lesion. So we always see a radiographic lesion. It may be a widened PDL, more than the widened PDL that we see with acute apical. And these are not super erupted teeth. So it's just a widened PDL, maybe 1 or 2 millimeters, up to a centimeter, and sometimes even larger radiolucency at the apex. The infection always destroys the lamina dura. What's the lamina dura? It's the white cortex that lines the socket. So the infection destroys that. So you'll see loss of the lamina dura and a radiolucency. It's usually fairly well defined. Sometimes it has a little bit of a blending border at the outside. But it's there. Not usually corticated. Occasionally it is, but not usually corticated. So when we see periapical lucencies, the first thing we should always think of is disease of pulpal origin infection. And if there are no symptoms, number one choice is chronic apical periodontitis. We have another term that dentists use a lot for this called dental granuloma. A little easier to remember because it's only 2 words. You're welcome to use it. I have no problem if you use both terms, are perfectly acceptable. But yeah, these can get big, and they can be there for a long time if patients are dental phobic and don't want to go in and get their dental problems addressed. If We have the opportunity to remove that tissue histologically and examine it surgically and examine it histologically. We are not going to see pus, no exudate. It is not acute inflammation. We see lots of chronic inflammatory cells, lymphocytes, plasma cells, lots and lots of plasma cells. More of them in the middle, and as you progress toward the edge, we just see granulation tissue. So granulation tissue is our host response that walls off and contains the infection and gives us our high resistance to keep the infection contained. And again, treatment, like everything else, depends on the restorability of the tooth. If it's restorable, we do root canal therapy. If we don't, we extract and replace. There are lots of options for replacements these days. So let's go on to our other periapical type of disease that comes from necrotic teeth, and that is the classic dental abscess. Sometimes we call them periapical abscesses. I prefer the term dental abscess. But what makes it an abscess? We studied inflammation in our general path topics. We studied an abscess. What morphologic pattern of inflammation was an abscess? Anybody remember that far back? Pardon? The name of the morphologic pattern of inflammation. Anybody remember that? It was in our category of suppurative infection, which has acute inflammation with pus production. It has active exudation. So yes, there's fluid on the inside, and that fluid is purulent exudate, and it's loaded with bacteria. When we have active acute inflammation that's producing more and more exudate, that creates pressure. Pressure always creates pain. Dental abscesses are always symptomatic. Besides that, the exudate has to go somewhere. It follows the path of least resistance. It can destroy bone and work through bone. It can go up the PDL, and we can have suppuration coming out the PDL. So you probe around the tooth and pus comes out. Ooh, cool. If there's a huge hole in the top of the tooth, it can drain right through the coronal portion of the tooth, and that's actually the least symptomatic because that allows rapid egress of the exudate, and so you don't have the pressure buildup. Doesn't hurt as much. But it's going to go somewhere. Typically, it tunnels through the bone and creates a localized swelling. So virtually always when we have a dental abscess, we have a tooth that's very symptomatic, has swelling because of that pus production. The pain, the patient may not be able to tell you which tooth hurts because of the spread of infection. It's not being adequately contained in the active suppuration. Sometimes it's several teeth in a row that hurt. And so the dentist has to examine the patient carefully and do pulp testing to figure out which tooth is the source of the problem. But we always look for pain, swelling, and almost always there's an obvious radiographic lesion, and it can be big. Sometimes it's just a widened PDL because the pus found a pathway for escape before it destroyed enough bone to have a huge lesion. But there will always be some radiographic changes with these, but very, very severe pain. One of the interesting things with these is that chewing on ice or ice water helps relieve the pain. Do you know why? Because fluids shrink when they're colder, and it helps relieve the pressure internally. Isn't that interesting? Whereas the other types of pulpal problems, ice and ice water sends them through the roof. So it's kind of interesting. So I gave you some pictures, and you can see in the pictures places where pus is collecting, but it's localized. It's not spreading all over through the tissues. It's still localized, but we do get pockets of pus in the tissue. Sometimes it's a little farther away from the tooth than you might expect, and sometimes it's right next to it. When you look at your radiographic features, how do we distinguish that from a dental granuloma? No, they're the same. I think it's really important that you recognize that radiographically, A dental granuloma that has chronic contained infection can look absolutely identical to a dental abscess. So how do we distinguish the two diseases? The clinical findings. One has pain, the other doesn't. So your clinical story really, really is important, your clinical findings in diagnosing your periapical diseases. But other than that, they're the same. Treatment, depending on how much swelling there is, they may need to use antibiotics. Of all the reasons we prescribe antibiotics for dental infections, abscess is the most common one. And do need to establish a pathway of drainage so the exudate can get out. We do not normally treat acute abscesses the same day for the same reasons. We can't get good infection, and we have a situation where if we go in and do surgery, we might actually be spreading infection. So normally we open the tooth for drainage, give antibiotics, wait a few days, usually 3. It takes about 3 days for antibiotics to really control it. And then we can do root canal therapy if it's a restorable tooth, or extract it. But we don't like to extract unless we have the infection controlled. If we don't treat the infection, which is often our dental phobes, that infection is going to go places. One of the places it can go is into the bloodstream, and we can get sepsis. I didn't list that in your possible complications, but that is one. So one of the staff people in the insurance office where I have my homeowner's insurance and car insurance, I was in there, I was adding a new car to my policy once, and she says, "Oh, you're a dentist?" I said, "Yeah." She says, "I need to talk to you about my mother." She says, "I'm trying to decide if I should hire an attorney because my mom died because of an infected tooth." So her mom was very, very dental phobic, got a really, really bad toothache, didn't go in. Finally, it hurt so bad that she went in. The dentist referred her immediately to the emergency room. She went the same day to the emergency room. They hospitalized her, put her on IV antibiotics, but she was already septic, and she died because the infection spread to her bloodstream. So the gal asked me, should I hire an attorney because the dentist did something wrong and didn't give her antibiotics in the office? It's like, no. This is on your mom because she didn't go to the dentist soon enough. He could have given her antibiotics that moment, sent her to the ER a few hours, if 30 minutes later, it wouldn't have made any difference. So, that was not malpractice, but it was a horrible tragedy. So don't forget that these are all potentially life-threatening infections, and they do need to be treated. Sometimes the host doesn't contain it adequately. Our host responses are awesome, but they're not perfect, and we can have spread of infection. Typically, the spread of infection is just the exudate traveling to a different site where it still remains localized, but not always so. And I put some pictures that show the different places it can go, depending which anatomic space it spreads to. When it spreads to underneath the gum tissue right next to the tooth, and we call that a gum boil or a parulus. It's kind of yellowish. You can see a swelling that's yellowish right next to the tooth. If it's not draining, it's a parulus. And if it's actively draining, what do we call it? I bet you've already learned this. A sinus tract. Sinus tract if it's draining. But they can go all over the place. They're really interesting. And parulus is actually really common. Draining sinus tracts are really, really common. The bad thing about a draining sinus tract is it relieves the pressure and gives the patient an excuse not to go in. Very unfortunate, because that's when we end up with situations where we can get sepsis from infection getting into the bloodstream. There are some other complications that you should know about if a dental abscess isn't treated soon enough and the infection spreads. One of the complications we can have is we lose containment, and it progresses from an abscess to cellulitis. So what did we learn in general path is the most common organism that produces an abscess? Most common infection that produces an abscess is staph organisms like Staph aureus, things like that. Do we have staph in the mouth? Is it part of our normal flora? Not usually. What do we have lots and lots of in the mouth? We have lots and lots of strep. And strep organisms have hyaluronidase. So if we lose containment of our dental infection because of the strep organisms, we can get cellulitis. So cellulitis just means that the infection is actively spreading in the tissue. Instead of having a localized pocket of pus, we now have pus diffusely spreading through the tissues, causing swelling and redness. If it's just limited to one area, it's cellulitis. What are we going to do with patients that present to the dental office with cellulitis associated with an infected tooth?
Emergency room.
Immediate antibiotics, established drainage and immediate antibiotics. And depending on how far it's gotten and how big it is, they might need to go to the emergency room. So there are two situations where we send them to the emergency room. When it is maxillary infection that's near that cavernous sinus where it could spread to the brain, or when it's mandibular infection and it's spreading to both sides. So we can get Ludwig angina, and I have a picture of that a little bit later. So actually that's next on my list. Ludwig angina is when we get cellulitis that involves both sides of the neck and submandibular tissues and all three fascial planes. So submandibular space, sublingual space, and I forget the lateral pharyngeal space, I think. Submental. Anyway, there are three spaces there. I need to talk to Dr. Wright and review my anatomy. But when we get cellulitis on both sides in all of those spaces, the pressure from the exudate that's building up compresses the airway, and it can cause suffocation of the patient. So Ludwig angina is always a medical emergency, and that's when you always send to the emergency room. So you can start your antibiotics in office, but those are patients that have to go to the emergency room. Did I show you the pictures of the Ludwig angina?
It's on the PowerPoint.
But did I show you? Did we talk about it? Yeah. I'll have to show it. I have a really good case. Sometimes I show it with inflammation, but I don't remember if I showed you guys. Anyway, cavernous sinus thrombosis is when it travels to the brain through the cavernous sinus. So those two patterns of spread for cellulitis are the ones that are always emergency situations where they go to the emergency room. So what if the dentist doesn't send them to the emergency room? The hygienist calls the dentist out and says, I think you should send that patient to the emergency room. Anyway, you're part of the team. Don't be afraid to speak up because you could be saving the patient's life. Dentists are really busy and sometimes don't think, So you gotta be their conscience. It's like, oh yeah, this is a little more serious than usual. I'll send that patient to the emergency room. Another complication that we can get with an untreated dental abscess can also occur from a long-standing dental granuloma that loses containment, and occasionally from post-extraction infections. But it can be a complication from an untreated dental abscess, so we'll talk about it here, we'll talk about it again in bone diseases, and that's osteomyelitis. Osteo means bone, myelo means marrow, itis means inflammation. So osteomyelitis is the diagnosis that we have when we have an infection that's actively spreading through bone, through the marrow spaces. It's not contained, it's not walled off, and it can spread very far, very fast. The infection produces necrosis of the bony trabeculae. It destroys bone and is a very serious infection. So what happens if you don't treat osteomyelitis? Where is it going to go next? The bloodstream. And you can get sepsis next. So osteomyelitis is a serious complication of an abscess or other dental infection. And we'll look at what that looks like really when we get to bone diseases. I put some nice examples of complications in your PowerPoint for study. The gum boils, the lovely little pus pockets in the gingiva by teeth that are filled with exudate. What's the diagnosis for the tooth when we see a parulus? Diagnosis for the tooth is dental abscess. It's a necrotic pulp and a dental abscess. But the diagnostic term for that localized swelling itself, if I ask you what is the diagnosis for the swelling, it's parulus, not dental abscess. Does that make sense? Because I test it both ways. Okay? And I gave you a whole bunch of those. Yep, there's our cellulitis and our Ludwig angina. All right, the Ludwig angina in the submandibular region, in the picture shown, that's not bilateral enough to be Ludwig angina, but that would be the next step. That's still cellulitis in the submandibular area, but it would have to look like that on both sides to be Ludwig angina. Question? So when we see that localized swelling next to the infected tooth where pus is collecting under the surface, and that we have that little yellowish, soft, fluctuant swelling, but it's not actively draining, that's when we call it parulus. So the diagnosis for that localized swelling is parulus, but the diagnosis for the tooth is dental abscess. The tooth is abscessed, the localized lesion is a parulus. It's the complication or the overt manifestation there. And same with cellulitis and Ludwig angina. The diagnosis for the tooth is abscess, but the soft tissue infection has its own name. I put a little table in your study PowerPoint that summarizes the symptoms, vitality test results, and radiographic findings for the different types of pulpal and periapical diseases. You are not really responsible for the vitality testing, except to recognize that once we have a necrotic pulp, it doesn't respond to any of the pulp tests. That's how we know that it's dead. So you're really responsible for the clinical and radiographic changes that are characteristic of the disease process. So the acute pulpitis, irreversible pulpitis, reversible pulpitis, chronic pulpitis, those are really the dentists, but you need to know acute apical periodontitis, dental granuloma, and our abscess. Cyst we haven't gotten to, but that is next on our list. So what did we learn a cyst is? Basic definition for a cyst. We talked about that. It's a sac of fluid lined with epithelium. And we can get soft tissue cysts. Did you skip the soft tissue cysts with Dr. Grandi's? You did the nasolabial cyst. Excellent. That's a fun one. Dermoid cyst. Good. So you've had some soft tissue cysts. We can get cysts in bone as well. And the radicular cyst is the most common cyst that we see in bone. And it always arises in the setting of an infected tooth, a non-vital tooth, a necrotic pulp that has not been treated and went to a periapical lesion that was a dental granuloma. We don't go directly from acute apical periodontitis to 2 weeks later having a cyst. So, did you study how teeth form and the different stages of tooth formation and the different names of the tissues that form them? Yeah, you studied that kind of thing. After teeth are done forming, the tissues that form the teeth normally involute. They disappear through apoptosis. But sometimes we get some residual rests of tissue, and we can get rests of odontogenic epithelium in the periodontal ligament space that remain. We can get some that remain in bone. We can even get some that remain in soft tissue, particularly in the retromolar pad. So we can get residual epithelium that's just sitting there, inactive, 2 or 3 cells, just sitting there doing nothing. But if we have a periapical infection, and we have lots and lots of inflammatory cells, those inflammatory cells, those lymphocytes, produce mediators for inflammation that can have growth factor properties and stimulate proliferation of epithelial cells that might be in the periodontal ligament space. So over time, those epithelial cells can proliferate, and because there's infection, the infection gets in there and we get collection of exudate. It'll form a cavity and it starts collecting fluid. So then we get a balloon that starts expanding. And that's what we call a radicular cyst or a periapical cyst. I kind of prefer the term radicular cyst because sometimes they do form lateral to the tooth, where we have the infection going out a lateral canal, but the overwhelming majority of them are in the periapical area. So if you want to call them periapical cysts, everybody knows what you're talking about, and you're almost always right. But these are common. Which is more common, dental granuloma or radicular cyst?
Dental granuloma.
Dental granuloma. Always a lot more common, because you can't get the cyst unless you have a pre-existing granuloma, and the majority of granulomas don't progress to a cyst. But sometimes they do. What does the radicular cyst look like radiographically? Well, it looks like a periapical lucency that's fairly well defined. There's loss of the periapical lamina dura. Does that sound familiar? Yeah, radiographically these usually look just like a dental granuloma or an abscess, except there are no symptoms, and so everything about the clinical presentation usually looks like dental granuloma. So how do you know it's a cyst? You do root canal therapy and the lesion doesn't go away, because getting rid of the source of infection will not eradicate the epithelium that lines the cavity that's filled with fluid. It may stop enlarging, but it's not going to go away. So when we have a cyst, we always have to treat the cyst separately from the infection. And sometimes we extract the tooth because it wasn't restorable, but we didn't curette out the stuff at the apex, and it doesn't heal. After the extraction, we have a residual cyst that was a radicular cyst that stayed in the tissue afterwards. So they're kind of interesting. Occasionally, a radicular cyst will develop a cortex on the outside of it. That's a little bit of a hint that it's a radicular cyst instead of dental granuloma. But dental granulomas occasionally get a cortex too. Not very often, but occasionally. So we really can't tell them apart. If we do surgery, like extract the tooth or endodontic surgery and curette out the tissue and send it in microscopically, that's when we know we have a cyst. Do you know what the standard of care is for removal of tissue? If you remove tissue, it goes for pathology examination, always. And, I mean, unless it's so scanty that it goes up your suction, you collect it and you send it in. And some of the endodontists don't want to follow that standard of care because patients don't want to pay for it. But if you remove tissue and you didn't send it in, and then your periapical lesion didn't go away or it comes back, and you do surgery again and find out it's cyst, then it's malpractice and it's on the dentist. So it should always be sent in. So really the best way to distinguish between a radicular cyst and a dental granuloma is histologic examination. If we extract a tooth that has a periapical lesion, the standard of care is to curette really well and make sure all of that abnormal tissue is gone. And if you can collect any of it and send it in, that's always the best. That's the standard of care. What if the dentist extracts the tooth and the tooth comes out with a ball of tissue attached to the apex? You put the whole thing in your jar of formalin and you send it off because that tissue is not normal and it should be sent in for pathology. When I was in dental school, even extracted teeth that looked normal and didn't have anything attached to them had to be sent to the pathologist for gross examination. Gratefully, we have removed that standard of care because that was a bit ridiculous. But if you have tissue attached to a tooth that's not normal tissue, you're supposed to send the tooth down. If you have tissue that you remove from the body during a surgery or dental procedure, it should be sent in. Do you ever remove tissue when you're cleaning teeth?
Sometimes.
Sometimes. So that little tiny bits of stuff that's too small to process that ends up on your gauze, you don't have to send that in. No. Because it's not even big enough to process. So that you don't have to worry about. If we're talking about a chunk of tissue, a little chunk of tissue. Oh, I have a nice picture of a really, really big radicular cyst, so they can continue to enlarge if they're not removed. So And they do have to be treated surgically. They do have to remove that lining and get the whole thing out in order for those to go away. And I brought some histology so you can actually see the epithelial lining in the cyst. So that's what distinguishes our granuloma from our radicular cyst. We always look for the epithelium. So I showed you some examples. Treatment for radicular cyst, always remember if it really is a cyst, you have to treat the tooth, the source of infection, and the cyst itself. So I think that's it. One last thing. I don't know if we can do it in 2 minutes, but we'll try. If not, we have another opportunity to look at that. And this is the one exception to the rule where we can get periapical lesion, bony lesion, associated with a tooth that is not necrotic yet. It has pulpitis, but it's not necrotic yet. And that is condensing osteitis. Condensing osteitis has some other names. This is the one that I grew up with, so I prefer it. Osteitis means inflammation in the bone. Condensing means that inflammation induces increased bone production. So this is a situation where we have a pulpitis, a chronic pulpitis. It usually starts out reversible, may eventually become irreversible, but a lot of times it's reversible for a long period of time. But the inflammatory mediators from the pulp diffuse through into the periapical tissue. We do have that host resistance thing, and those mediators stimulate bone production. So gradually over time we get increased density in the periapical area, blending with the normal bone at the peripheries. The bony changes do not need to be specifically treated, but whenever we see this, we need to assess the tooth. The tooth needs to be diagnosed to find out, is the pulp still alive or not alive? Sometimes you just need to do a restoration to get rid of the decay. Other times root canal therapy is necessary. And over time, if it's not treated, the tooth will become necrotic, usually. So depending how long it's been there, you could find a necrotic pulp, a dead tooth, or a tooth with pulpitis. So, but it always starts when the tooth is still alive. I think that's a really important thing to remember for condensing osteitis. So you see the picture where there's increased density around the root of the tooth? Do you notice that you can still see the PDL on the end of the root? That's an important feature of condensing osteitis. And you notice how it just kind of feathers and blends at the edge with the normal trabecular pattern. It's very, very characteristic. When you look at the crown of the tooth in the picture, do you see anything that makes you think this tooth could have pulpitis? Yes. There's huge restoration, really, really, really deep, like to the pulp space. It's not a surprise that we would have a pulpal problem. If we see this pattern of radiographic change around the root of a tooth, but we look at the crown of the tooth and there's nothing wrong with it, no decay, no big restorations, it's not condensing osteitis. It's something else. Okay? And that is all we have time for. We almost got through it. We did pretty good considering we had no projector. I will test out this room before Friday to make sure that we have a projector. Because our next topic we cannot cover this way. It will not work. I'll check it out and see if we have other options. Oh, I can't reserve a room when I'm not in the building, and so that's something I have to check as soon as I get upstairs. So I will find a room. Quick question. I know you need to go to clinic really fast, but I have two different options for our exam reviews. We finish class at 11. Would you rather do exam reviews from 11 to like 2, or do you want to do 1 to 3? We need a little bit longer. So will you all get lunch that way? Still get lunch? You'd rather go 11 to 2? All right, I'll see if Dr. Gandhi could do that. I kind of thought it might work better for most people's schedules. Put this down.
You're welcome.
Oh, no. I didn't.
No, but you really are.
Okay.
All of
We're
us.
seniors.
Like 5.
Yeah, we're going to be working on our project. There's time I might drop down.
Good morning. Is there any way that because I have doctor appointment at 1:30 on Friday and I should drive back to Orange County, so I tried to take an appointment after 11. But if it's full, is there any way that I be there?
I will add you manually to our earlier
Yes.
appointment. As soon as you get the announcement that it's there, make sure you sign up right away.
Thank you so much.
I have a strange question for you.
Yes.
What do you think about laser hair removal? Is that safe or do you?
Oh, yeah.
Yeah?
It is safe.
Okay.
I've looked into it, and I'm not a candidate because it only works on her.
Yeah. I was just curious. 'Cause I was like, I don't.
So what it does is destroy the follicle. Yeah.
But I didn't know like what kind of like
They,
what the laser is emitting. I guess.
so the laser emits a light that reacts with pigment in the follicle and produces, I think it produces heat that destroys the cells.
I see. Okay.
Yeah, but they use a special wavelength of light that won't damage the other tissue around it. So they have some really sophisticated
Yeah.
lasers, so it is supposed to be very safe.
Okay.
And it is
Doesn't
supposed
cause
to be
cancer or
very,
anything?
no.
Okay.
No.
So I'm like, oh, I don't understand it. But okay.
Yeah. Laser light is not in the spectrum that produces those chronic sun-related mutations.
So
as
same
far as
thing
we
for
know.
like the kinds of facials that they use lasers. It's the same type of.
Actually, the facials with lasers are healing lasers. They stimulate healing responses and they're healthy for your skin. And they can use certain LED lights as well to do that. So,
I just wanted to ask.
yeah, no, they're supposed to be safe and healthy. But lasers haven't been here that long.
Yeah, I know. That's why I'm kind of like. I don't know, like if there's any.
Right, so they could find out in 50 years that it wasn't safe as they thought.
Yeah.
Dr. Tristan, the last thing of condensing would we would we classify that as an overreaction? I was just processing.
Yeah.
Great, thank you.
Yeah, I mean, I don't mind. Just let me know. Yeah, because you can do with Bella, so I'll just let Bella text us, because that's Bella's trying to send it to you back. And when you get back to us, we can do your time around before you get into the hospital that day.
Yeah, that's great, because then I won't have to make sure I have it.
I would literally like
Yeah.
the study. I probably forget. That works. I think it's just something I literally don't like anything. Like I would still like for the wall. Yeah. Did you go upstairs study?
Yeah, bro. It's already done.
I have it in the car out there, but I realize like it's really different. I usually had some on my fingers, but I never restocked.
Yeah, bro.
I don't know how I got it.
It's because when we had extended
Yeah, I know I have some in my car, it's just like it's not.
Look,
I was just in the bathroom, yeah, like, getting myself long out.
Oh yeah.
Yeah. It's just boring. It's like really, really
Is
long.
that the one where we did the project with Shay?
Yeah. Because I just
This is?
I don't remember.
Yeah, he
I
would
just
like,
passed.
I thought article you have to read.
All the period planets are going to be born this way.
So like if it's like
Is in a meeting that's going to run late again, so.
I'm gonna be all sudden on panic.
Yeah.
Yeah. Leaving the baby with my mom. I thought I was gonna be outside, so what if she has to change or this or that? Like I figured, like because I don't need to be struggling if she's crying, you're not enjoying it. What? Really, you're with your mom for a few hours and you'll figure out after. Yeah. Are you going for a bath?
Yeah.
Okay.
Is it bad?
I know. I need a tan.
Oh, just wait.
Very.
Oh, yeah.
Very. I walked
wait.
past her. I know.
Just
Like,
wait.
her smile was
There's
the
no
biggest
accent.
I've ever seen
You guys
anyone
say
smile.
I didn't say anything.
You'll see.
I have a dress like back of it, but it's on the shoulders.
Somebody hacked for a car.
I mean, that'd be of course then I'd be like,
Yeah. No, yeah, it's gonna be like
yeah, come on.
It's just like half showing.
Yeah.
Literally.
Thank you. I'll get it back.
Oh, no, it's okay.
All right,
So many-
bye. Have a good day.
Bingo.
I have like 3 because I always forget them.
Yeah, I know.
I don't like that.
I was so much money. I think everybody did. I'm almost last place now. I'm pretty proud of myself. That's my new goal. Yeah, my new goal is to lose. I'm very bad.
Nobody's doing it.
Okay, especially now. I'm like very first right now. I think, or last I checked, maybe it got down.
I don't know. I keep covered with
I was at 25 for quite a while.
I keep going.
Is Sean still in first place?
I think Sean just kind of like gives some investments and just like.
Yeah, you guys were.
That's what I did.
He was down, like he was chilling out first for a while, and then when everything got messed up, he was down, and now he's first again.
It's gonna be sweet.
I'm better than our instructor.
I think
Oh yeah.
I hope they
I
speak
think I'm
more
lost.
than the other one.
Yeah, just a little bit.
It's like
Things.
super.
We're only like
Way wrapped up.
200 off.
How is it? Because if they sweep it, the other one doesn't get set. It's like how many extra
I
days?
just did not
Maybe one
understand.
over.
Maybe you're complicated how to win.
No, I want the Raptors.
How was Raptors do that?
I had understood some more things I think you were.
I tell I would be crazy about it if I understood. I still like have, I still sort of refuse to test it out, but I think maybe you're one money is fine. Oh yeah. I just like I will not.
Apple is really
Because he's putting the phone
I don't know what I read, but half of what I posted, I don't even post it.
no, it's inside.
It's like, oh, this one's pretty. Or letters, whatever they are.
I doubt it.
Dude, I started thinking all last night. Because I thought I had any
Yeah, well, we drove.
I see it back there. But I was thinking, I was like, okay. So, I don't know if this is going right. Because then I was like,
Yeah, but
yeah, no, pues me tengo sí. Es un chingado, pero pienso que yo, oh well. Oh, it could have like back. Either way, I need to buy it anyways. Yeah. So I was like, oh, where I need like shoes. Yo, oh well, I don't like shoes. I never wear black shoes. I always wear like dark brown to light brown. So those great.
Yeah, here I will show you.
I didn't want to go. And we're like,
Yeah, exactly. Figure out if anything I own already will work.
that's exactly how I was like, the picture that doesn't look too good. Because I shouldn't say anything. So I texted
This was when you said she wanted the questions, and I was like, yeah. So like the rubric you have, the rubric in the top is for the bottom is the second part. Well, and the second part, I think was the art section. So I was like, she's gonna say
there's a one like everyone that's really light.
I think it was you.
What? There, it was you. I should
I mean, maybe it was that they hadn't taken their test yet.
I
mean, they probably wouldn't make that kind of knowledge, but
I feel like I've seen it do that fast.
But like, it's very going to be a moment. I don't know. I was like, like you mentioned before, it's like,
I might never. Let's say it's the PC for him. So I know how to switch it for PC for the touch screen, the okay, so what do you
but I mean, that's the biggest one.
okay.
We just want to take the day right
Like someone she's walking
Okay, Rob, the light is on.
Yeah, that's
Okay.
Did you tell her what you wanted yesterday? I just told her. I told her. Somebody probably hacked her account. No offense. It's not like I know because it's not confident. No, it's not that. Oh, I'm believing you.
Yes.
But she doesn't, even if you do good, she doesn't say things like that.
Oh.
She's like, I'm proud of you.
Okay, here's the entrance.
When I saw that,
It was amazing. What did you get?
Yeah, I see it. Okay. Now for the three, probably no audience. Okay. Oh, okay. Test. Okay. Test. Somehow the audio is not working. But so for, let me check one more time here. Test. Now for the, so 3 is the laptop. And input HDMI input 1 to 3. Now for the HDMI input 7.
I'm already there, kind of. I know in my head I'm there too. I'm like, I'm done.
The 7 is DM.
Yeah. When I checked my score, like, I was like, you texted it, and I was sleeping.
So it's in my 7 to 3. Okay, I'll put that. Okay.
I just randomly checked in and I was like, oh, the result is still not up. And then there was this random number at the bottom and I was like, right? What is this? I said pass and I was like,
Yeah, if you can email it to me. So for now, I can do this until the room is clear, and then I'll call you when. Yeah. Okay. Thanks. Okay. Okay, thanks.
And I started crying.
Okay.
Like, I started texting.
Wow,
And
and
then-
then I couldn't live the 8 and texted me right away. She was like, I
She didn't come in last year, and I was like, oh, she did. I swore that I took her to the doctor, but I guess it
I saw her, but
it would be like snow. Yeah. Your little one? The little sassiness?
I expected for you to text us too, so I was like waiting.
I was going to post it too, and I was like, I don't know.
Waiting, and then I should text her.
I know you. And then I told her no, I didn't come.
Yeah, but I didn't understand what you mean actually.
No.
She really liked that. Yes,
Like I'm still checking.
Calm it down.
And I was like, what if it's she doing? No. A girl? You never know. I don't know. I think I'm just I was struggling the first half. Like I was like, what? Like I was like, I can literally. So that's why I was so scared.
Because now it wasn't like very crazy.
No, it was like things that like actually studied more.
But just not feeling right.
Yeah, I struggle with medication. That's the only thing I struggle with. Because some of them, like, oh my god, I can't.
Oh, you have it done?
And sometimes I can recognize.
Oh, you're using CD?
Yeah. I go very low tech these days.
Except before the case studies.
Yeah, and I found that not all the dongles, you don't always have the dongles you need, right?
Yeah.
So cables to go have to be packed.
And then I happened to get another screen the same day. And it was the same thing.
So is there a software update, like what's on my computer or something else? No, I got a Windows update last night. That's what I was-
Yeah, I thought about it.
Hi, Sean.
What happened? Oh, this is what I'm doing here is
Corporate espionage.
Okay. I don't want any student touching on this side.
Okay.
Yeah.
Pay no attention to the man behind the curtain.
Guess we got everyone here.
Yeah, we're going to be shorter class today because folks have gone to Oxnard. Must be a song in there somewhere.
All right.
Yes.
Before we start, I'm just wondering, do we have any consensus on what we're giving Jeanette?
I thought we said spa.
Spa.
How about some fixed scrubs? And a spa and a spa day.
That's why you just give us one.
No, because if you get spa, you should always get
Stuck
two.
with,
So that you can get go with
So, I always forget how to do a talk.
Okay.
One spot.
Who wants to give hers? I think we have a pretty good.
Is it play?
We have pretty good consensus. Do you want to see a show of hands, like how many people agree to give her like
It
spa?
doesn't have a.
Spa for two?
Okay, we'll do it.
Well, in theory, it should auto load, but it doesn't do that either.
So I was thinking, do you
Oh,
guys
we
have
need
like
to
a limit or amount that you want? Because we have.
Oh,
a
you're
decent
just
amount of
using
money.
the CD?
We
We
still
can plug
need
it in
money for the
here.
roses, but we kind of budgeted.
But didn't we say
Oh,
that?
the USB to this.
Oh, okay. It's all right. And let's. Can this just run this way or not?
Well, I'm trying to switch it. Somehow the
Yeah.
switch is not even working too.
Then you say we have this amount. If we don't,
Yeah.
then just we can
Yeah, I thought the money's coming back.
So like,
But are you asking how much? Are you asking how much for the certificates or?
Yeah, it was, well, okay, it kind of got confusing because like Barbara was saying that I'm gonna have, well, some of us are gonna have to go and purchase like roses from somewhere, so you guys don't have to go out individually and buy them. So we would do that for you and put them together.
We'll do a bulk order, so we can
Like a bulk order.
yeah, we can make it strong.
And then Barbara was saying like 3 as a limit, and then if you wanted more, then the money that you guys will be getting back, because there's still like, I think $20 left over or something like that, then you could buy more roses with that. I don't know what you guys think of that.
How I understood it is that we would get the gifts and then the extra money would go to us and then we could donate our own money, like Venmo you or something, to go to the roses. I don't want to pay extra money for the roses, so I just want the full amount without any taken out for other people's roses to come back to us.
Okay.
You know what, Jess, we always do that. Like if you have this $600 divided into everybody, back to them, and then from there they decide. Yeah, because maybe she wants 1 rose, but she wants 3, and I guess that's what she's trying to say. Like, because somebody wants 15 and somebody wants 1, it's kind of not fair.
Yeah, no, I get what you're saying. Okay. All right, we can do that. So what should be the limit for Barbara and
No, every time I press the 7 lit up, but on the DM screen it says
I guess a lot of the difference between
We
like,
have-
what is it, Glen Ivy versus some cheaper stuff.
yes.
Yeah, we have
But if I put the 6
1,500,
and it
like
says
15.
DM 7.
So I was thinking like 300 each or more for gifts. Is that a lot?
Coffee maker, $300.
I don't know if she needs a coffee maker. Like
Oh,
she
that's
has
probably
to.
across. I think I prefer
If you have a cheap one, so we're thinking about getting a fancy one.
You can get a really good coffee maker for
300, yeah.
even more.
You
They
can get an
cost more.
industrial machine, 300.
Okay. Should we talk to
Or
Barbara?
give her a $300 Hobby Lobby gift card. She'll love that.
So now it says intermediate.
Africa. Or
Yeah, I don't know if
I like-
use it often.
Yeah, like what Marianne said, like make a basket and maybe we can put like a coffee maker with that, but not.
Get her a cricket.
What is, I don't know.
What's that?
It's like crafty and she likes making that stuff and it like cuts out shapes and like cuts out decals.
Oh,
Because you know she likes decorating stuff, so.
Yeah.
oh, it's I know what you're talking about.
Okay.
Yeah.
Well, I want us to decide now so that I could get it all this weekend, because I have to get the roses before Thursday, like the rehearsal.
Yeah.
So to figure all that out and have time and budget and everything,
Yeah.
gotta get them this weekend.
It's not detecting the.
Okay.
And then just I'll figure out what spot she likes.
Yeah. Yeah. Somewhere. Yeah. Somewhere.
Yeah, the PC works.
Should we add Barbara
Oh,
to
there.
this spot
Oh.
or just straight? Okay.
No, it's
Okay.
no, it's just a.
Yeah.
300 each.
300 each? Does that sound good?
Yeah.
Okay.
How far are we getting in?
We're gonna
Cynthia's gonna figure it out.
What's that one here, like that?
Like if she thinks it's you know, I'm not
Do it again.
Okay, so I've got screen mirroring on now. There we go. So I can do my thing. I just can't see, yeah, I can't see the screen, but
Yeah.
I know.
Are you able to see it from there? Oh yeah, you good.
I can just do this. Maybe. Oh.
Yeah, it works, but okay.
Rental real estate. Real estate's been
All
quite
right,
the range for the past decade. You seem like you could do no wrong, and all of a sudden people are starting to realize they have done wrong. It is the least liquid consumer investment. And I'm a big fan of real estate. Dave and Sharon Ramsey have 2 kinds of investments. Paid for real estate and mutual funds. That's it. Don't have anything fancy. That's all we do. Paid for real estate and mutual funds. But I will tell you this, real estate will make you broker and broker and broker. That's why they call them brokers. If you buy real estate when you don't have any money, you will crash. It is not a broke person's game. So build up a little bit of wealth, Get your baby steps done, get your home paid off, and then start plinking off and buying some properties and paying for them, and then you're going to have a really sweet thing in your portfolio. But you start buying a bunch of stuff with a bunch of payments and the renters don't pay, all of a sudden you're back where I was 20 years ago and you're bankrupt. You should have a lot of cash before using real estate as an investment. Real estate eats cash, no question about it. Buy slowly. Always buy investment properties with cash. Nothing down real estate is a one-way ticket to bankruptcy court. Never pay retail. When you're buying real estate, all good real estate investors will tell you that that all your money is made in real estate at the buy. So circle like a friendly vulture and get you a serious bargain when you buy something. You don't want to pay full price ever when you're an investor. You want to get a deal. Just wait. Patience. Get you a deal. Use cash. Get you a deal. Use the negotiating stuff we talked about in the That's Not Good Enough lesson, the bargain hunting lesson. Use that stuff when you're buying real estate. Get a bargain on it. Win with your real estate purchases. Your money's made at the buy. Now, fixed annuities, let's look at annuities for a second. Annuities are a savings account with the insurance company. That's all an annuity is. You think a savings account with a bank is a certificate of deposit. A savings account with an insurance company is an annuity. That's all an annuity is. It's nothing fancy, nothing sophisticated. There are two main types of annuities. Number one, fixed annuities. These are crummy. They give a low rate of return. It's basically a savings account with an insurance company. They're going to pay around 5%. They aren't really fixed, actually, but that's what they call them. And they're bad long-term investments because they don't pay enough. The only annuities I like are variable annuities. Now, variable annuities are mutual funds inside of an annuity. So let's pretend that this cookie jar represents an investment. And that for purposes of this discussion, this investment might be mutual funds. This cookie jar could be mutual funds. All an annuity is a coat that comes around the investment to keep it warm, right? And if it keeps it warm, it keeps taxes off of it. All right? And you pay for the coat. So you pay an annuity fee and you pay a mutual fund fee. Both. But we're keeping it warm from taxes by putting it in an annuity. That is a good part of the variable annuity. So it's a way to buy mutual funds if you've maxed out all your retirement and your house is paid for and everything else. It's a way to buy mutual funds and let them grow without paying taxes on them as they grow. And you pay an extra fee for that. Some of these have some really cool features. These variable annuities. They will guarantee your principal. If it goes down in value, the mutual funds do, they will guarantee what you put $100,000 in there, they'll guarantee it. That's kind of nice, especially when folks get a little bit older and they're wanting to do some investing. And some of them are even giving you a floor. They're saying, well, we'll pay you at least 8%, knowing that the stock market has averaged 12. That's a pretty safe bet for them. But they give you this floor on interest rates and a guarantee on your principal. Nice little features for that coat, and it's kept warm for mutual funds. Now, I don't use variable annuities a lot because I want to be able to get at my money at my age a little bit. But if you want to use them as part of your investing after you've done all your other stuff, they have a place. But that's after you've maxed out everything else. Do not use a variable annuity inside of a thing that's already tax protected. How many of you are teachers or you're in the pastoral world, or maybe you work for a hospital and you have a 403B available? Anybody? 403B. Now 403B, a lot of times they'll offer you a variable annuity inside your 403B. Well, the 403B is already protected from taxes. But yet, when we put in a variable annuity, we put another coat around it, like it was still cold. It's redundant. You're paying too many fees for no reasons. Inside your 403B, just buy mutual funds. Don't buy something because it's already warm. It's already been covered by the 403B. And so don't do that. That's a redundant situation.
Yes, because everyone has something that's gold and they could sell it for a lot of money.
For now, it would be a good investment because it is very high in the market.
I mean, I only own like one gold thing.
Yeah, because actually later on it'll probably be a lot more expensive than it is now, and you get your money's worth out of it.
I think we're on a gold standard now.
I think gold is a very good investment just because it's something that's more value than paper.
Now, bad ideas in the investment world. Bad ideas. The first one is gold. There's gold commercials all over the radio. They're all over cable. Buy gold, buy gold. If the economy collapses, we'll use gold. No, we don't. That's just simply not true. Historical facts are gold is not used when an economy collapses since the Roman Empire. Find me one. You know anything about, did you ever take Western Silk? I mean, did you ever, look at them. There's no failed economy where gold became the standard. Where, you know, and let me give you a microcosm, a little micro failed economy, all right? You remember when Katrina hit New Orleans? There was nothing left. Just wiped it out, right? Anybody remember that? Say yeah. That, in a sense, that's a failed economy right then, isn't it? Okay? People weren't running around down there with little bags of gold. But I tell you what, a bottle of water or a can of gasoline will get you about anything you wanted. For a month or two there, with goods and services sold and bartered are what happens when an economy collapses. People don't go, here, I'll give you my ring. They don't want your ring, they want a bottle of water. That's what happens. So that's a bogus thing. Besides that, over a 50-year track record, gold has averaged 4.1%. Hadn't even kept up with inflation. So the only gold I've got is I got some pretty cool cufflinks and a decent gold watch. That's the only gold I got. I don't own a single piece of gold, nor would I ever recommend you buy gold. Number two, commodities and futures. Buying and selling stuff like pork bellies, or wheat futures, or oil futures. Any of you see the movie Trading Places with Eddie Murphy? That's what they were doing. They were running a scam in the middle of the commodities thing. Commodities is a great way to lose a bunch of money. Because really what you're betting on against is the weather. This is dumb. Have you ever noticed that the only two people who can keep their jobs are economists and weather forecasters, and to be wrong all the time? The rest of us, if we're wrong all the time, we lose our job. But they keep theirs. Who knows what it's going to do? You don't know. I bought a gold future one time. I put two dumb things together. Gold, and I bought futures. This friend of mine was playing golf with this guy, and he'd been picking gold prices in the commodities market. And 11 out of 11 times he had hit. Pretty impressive. I'm 25 years old, I know everything. And I've got $5,000. So I put $5,000 in a 92-day future. That means in 92 days, if gold prices hit a certain level, my $5,000 will be worth $50,000 as a tenfold kick. Pretty sweet. But if it doesn't hit that level, and if this guy goes 12 out of 12, I figure he's got a dozen in him, right? He's done 11 in a row, but he's probably got a dozen in him. I'm going to try this. So I put $5,000 in. And I'm thinking it's going to turn, if it doesn't hit that mark, though, you get zero. So it's 0 or 50 grand. In 92 days, I learned more about gold than I have in my entire life. I watched every day what gold was doing. I was freaking out about gold, and we lost every dollar of that. It didn't hit. He missed it. And that's what you usually do, playing around with stuff like that. Don't pay stupid tax. Stupid tax is when you lose money doing stupid things with money. Don't do stupid things with money and lose your money. I've paid lots of stupid tax. Learn from somebody else who's learned the hard way. Don't do it. Day trading. Day trading is stupid. CNN reports that 88% of the day traders lose money, and 70% lose nearly all of it. Not long ago, I had a lady from Louisville, Kentucky call me whose husband had lost $625,000 day trading. The last $150,000 of that $625,000 he lost, he had put on credit cards. You know why she called me? She wanted to know how she was going to make it as a single mom because she had left him the day before. He completely ruined his life, chasing a rainbow. It's not there. But he bought one of these systems, one of these get-rich-quick things, decided it was going to be easy, and he didn't have to do it the slow way, and he got his tail kicked in.
Jeff, why is day trading such a bad idea?
I can't imagine how that's a good idea, ever. What is some guy doing in his basement or at your company desk when you're supposed to be working, making changes on your 401k plan or buying stocks and then selling them? There's all kinds of this nonsense stuff sold on TV about when to buy a good stock and then how you're supposed to sell it. Statistically, you're not going to do well. In all seriousness, you'd be better off to take your money and go to Vegas and gamble because you don't know what you're doing and you're not going to make money.
Viaticals. Viaticals are just ridiculous. This is when you buy the beneficiary position on a life insurance policy of someone who's dying. They've got cancer. You figure they're going to make it 4 months. You're going to get $100,000 when they die, and you buy that for $60,000. But what'll happen is this guy's chemo kicks in, and he lives another 30 years. And that's what's happening. The Viaticals are full of fraud. It's a great place to get conned and scammed. As a matter of fact, the Federal Trade Commission lists it in the top 10 scams out there. And 38 states right now, the attorneys generals are doing investigations of biatical companies. If somebody comes to you with something like that, stay completely away from it. Listen, just keep it simple. If you're looking for a shortcut, you got the wrong spirit. That's not how wealth is built. It's built gradually, layer upon layer upon layer upon layer upon layer upon layer.
Jeff, if someone ends up in a bad investment, how can they go and approach this topic with their broker?
Well, I think there's levels of bad. If it's a bad investment just because you've lost a little money, that's not a big deal because the market could go down the day after you invest. So if it's a good long-term investment that has a great track record and it's down, then it's cool. But if it's an investment where it really looks like you were scammed or taken advantage of, then I would contact the broker. I'd do some research on the internet and find out what you have and what's available. And then if you were really scammed, then I would do some type of research with compliance regulation and tell them that I invested in this and it didn't work out and this is what my broker told me and come to some resolution.
Now we're going to talk about things like IRAs and 401ks and 403bs and 457s and all that stuff in another lesson where we talk about how to shelter, how to put a code around these different investments. But I want to close up with this. Not long ago, I was meeting with a guy having lunch. Now, I told you I like to hang out with somebody who's done something I haven't done to be able to learn from them. This guy's 72 years old and he's a billionaire. A billionaire. That's 1,000 million. Okay? You're beginning to get this. This is a lot. It's a lot more than I've ever seen. So when I have lunch with him, I've got my yellow pad out, I'm taking notes. I don't want to talk here. I'm not here to teach. I'm here to learn. I'm sitting at the feet of the Master. This guy's got a strong Christian faith. He's got a wonderful family. He's got a wonderful business. His life is pretty awesome looking in from the outside. I know folks have problems, and he probably has his share. But he's got $1 billion, and I want to know how you do this. I want to learn from him. You know what I'm saying? I've been blessed in the last few years to have lunch with several billionaires. I used to go have lunch with millionaires. Now I am one. I want to meet with billionaires. Yeah. These guys, there's only about 300 of them in the United States right now. It's pretty amazing. So, you know, they're fairly rare breed. So I'm sitting and talking to this guy, and I said, all right, so if you were me, and you were my age, you know a lot about what I do, what would you do? Great question, right? And he thought for a minute, and he said, well, there's two things that you must do if you want to win. I went, oh, good. One, I can do this out loud. 1, 2. This one I can do. It's always simple, isn't it? He said, one, I hear you on the radio when someone's hurting. I hear you give them a free book or you put them through your course. I hear you do that all the time. If you ever stop doing that, I'm going to call you and bust you. Because he says, I've never met anybody who wins at money that doesn't give. And he said, you keep that giving spirit if you want to win. Check. I can do that one. I got that one. We can do that. Second thing is, there's this book I read. Now, I'm a huge reader. I believe in reading. Leaders read. Everybody that wins is a reader. So I'm a book nut. I got books everywhere. And I'm going, book. Oh, good. I'm going to write the book down. What's a book? This guy's got a book for me. I love the book. He goes, this book is so good. He said, I read it to my grandkids over. Really? Your grandkids? I knew this stuff was simple. I tell people it's simple. Here I am. It's proven my theory. It's right. Simple. And he says, have you ever read the book, The Tortoise and the Hare? And I went, that's what you've got for me? The Tortoise and the Hare. And he said, yeah, Dave, I read The Tortoise and the Hare all the time. He said, I read it to my grandkids over and over and over again. He said, we live in a culture full of hares. The whole culture is ADD. They all need Ritalin. I mean, they're going bananas, you know? He said, there are so few tortoises. And he said, every time I read the book, the tortoise wins. Every time. I never get to the end of it. Chris is 22 years old, sends me an email. I love this when a 22-year-old asks you a question like this and is in college. So smart. He says, what are the common traits of a millionaire? Well, Chris, you already have one of them. It's asking questions and learning and growing. The average millionaire reads a non-fiction book a month. Find people that are what you want to be figure out what their habit patterns and character traits are, and become one of them, then you will become one of them. And so you're on track to do that already by just asking this question. Very smart. Great book out by Tom Stanley called The Millionaire Next Door, where he studied millionaires. It's the consummate study ever done of a group of millionaires and what their traits are. Number one, they usually buy and drive used cars. A lot of them are self-employed. Most of them are first generation rich, meaning they didn't start with daddy's money. And so that tells you and me, regular guys like us, we got a shot at becoming a millionaire. So you live on less than you make, you're conservative, and let me tell you one of the key qualities you'll find with the typical millionaire I've met with over the years. They really have almost no need to impress you. You know, all these other people run around trying to impress everybody, they're the ones that are broke. They're what people in Texas call big hat, no cattle. And so you need to actually have a plan where you don't care what the broke people think. And if you don't care what the broke people think, dude, you are on your way to be a millionaire. And then lastly, don't try to get rich quick. The best way to get rich quick is to get rich slow.
Jeff, can a college student become a millionaire?
All of them can. That's what's so neat. Every single kid in school can become a millionaire. All we have to do is a few things consistently over the long term. And really that just means you've never been in Arthur, that story. All you have to do is start young and invest consistently and you'll do well. That's the beauty of it, is a little bit of money invested over the long term, it makes everybody a millionaire.
So you are recommending students to make sure their tuition's paid for, they're out of debt, they have an emergency fund, and then anything else they get to throw at investments.
Yeah, you can't do it with all that debt. That's the biggest disappointment when people retire, is if they have a ton of debt, we have to take all this money that they've accumulated and pay off the debt, because the debt isn't going away until you pay it off. So if you can live a life where you never incur all that debt, especially when you're young, and then you'll have more money to invest, and then it's all yours, and you don't have to pay it back to anybody.
As a college student, investing may seem like an intimidating idea, but as Dave has explained, it is vital to start at a young age if you're financially ready. Time is on your side, and the earlier you start, the easier it is to grow tons of wealth. So if you have your emergency funds, are out of debt, and have a comfortable pile of money in the bank for your transition out of college, start investing today. It's an exciting thing to see your money make more money, but make sure you're in the right position before you start. Remember to find someone who can help you break it down easily, and make sure you understand everything before you start putting your money in. This is an exciting concept. You're planning out how you could become a millionaire. Imagine if you had millions of dollars. Think about the change you could make in this world.
Okay, so that was the leftovers from last week. Any questions about investments? Bueller? No questions, all right. So working with money and planning for the future and that kind of thing. If you don't have any experience, obviously it's big and scary, but hopefully you're getting to the point where you understand that if you apply a few simple concepts, that you will do fine, and some will do very well. Okay. Now we're going to go really low tech. All right. All right. So we don't have this yet. Who's got the sign-in sheet? Did it make it back? You got a copy of this? Okay, so this whole course is about reviewing your financial situation, right? You should be in pretty good shape about this. So here are some really kind of detailed steps on how you do that. When you're looking, even if you're just tire kicking, it's good practice to go and check out some properties to see if you might find something you like. Okay, so one is that you should always pull your credit report. Have you heard of a credit report? Okay, so there are 3 credit reporting agencies: Equifax, TransUnion, and what other escapes me. And you can you shouldn't ever pay somebody to pull your credit report. Once a year, you're entitled to a free copy of it by law. If you haven't gone out and pulled a copy ever, then you might want to do so. If you don't have any credit cards, your student loans will probably show up on that, but most of the time, if you don't have any credit cards, you won't have much credit history except for where you've lived.
So with the credit reporting, is it safe to rely on, to sign up for stuff like Credit Karma or some other agencies that monitor the credit?
You can. They'll tell you about the big things that happen. They won't get down to the details. And they don't usually give you a dispute process. You have to go to the individual credit report agencies for that. But it doesn't, why not? Well, you won't get a lot of detail out of them. But it doesn't hurt to have something to kind of monitor for you. The next thing is if you're doing more than just tire kicking, checking things out, then you need to look at your monthly budget, which you'll have a monthly budget, right, set for in the next couple of weeks. You've given me a draft. I still yet have to review that and get that back to you, but I will do that this week. Typically, you don't want to go any more than maximum of your gross income of 40%. Okay, and the reason is this. So when you buy a house, you're buying a container to put things in, right? But what don't you have? You don't have things that go in it, right? So you don't have a way to close the curtains because there are none, typically. So you have to go out and buy some of those. And you don't have a bed to sleep on unless you brought one from home. And then you need sheets and towels and that kind of thing, which you can kind of camp out in a house. But then, if you want to do any kind of entertaining, what don't you have? TV, couches, chairs, a table to sit at. So you can see why the economy, there's a thing called housing starts, or they look at the houses turnover and the like, and it's a nice bellwether for how the economy's going, because they know once you buy a house, you got to buy the things that go in the house, right? So it's not just the house. So if you go more than 40, some mortgage brokers will go say 42 to 3% of your gross income. Keep in mind who takes money right off the top. There are two that kind of have first dibs on your gross salary.
The government.
The government, taxes, and if you're a tither, the Lord, right? And so you can plan that about that 30 to 40% is already taken up of your gross pay on those claims, right? So if you go 40 to 42% of your gross pay on a mortgage, what do you have left over? About 18%. Okay, so can you live on 18% of your income? No, you got other things. So that's the reason that there's wisdom in trying to keep it to certain percentages. It would be better if you bought something, especially a first house, at around 28% of your gross, because then you have the ability to save and invest in your future and continue to do things like buying books to read. Maybe you have an interest in continuing your education. That would be another investment in you, right? We talked about investments, and that's one really good investment, is to invest in yourself, right? And then you've got to start saving for your kids, so they can invest in it, and you can invest in it too. All right? So that kind of gives you some perspective. 40 to 42% is really pushing it. If you have the kind of income where you can live on the 18%, and God bless you, that's awesome, and you can go ahead and do that. Keeping in mind that when you do get into real estate, at the beginning of this little session, he talked about rental real estate, but it applies to your house too. So at what point do you make money on real estate? Do you remember what he said in the video? Sean? There's a particular point when you actually make money in real estate. In the beginning. The buy. Yep, exactly. Good listen. So you try to get your best deal, okay, knowing what you can afford, get your best deal and negotiate that best deal at the front end, not hoping that somehow the California mortgage or housing prices will go up 20% a year, because that's fiction. It just doesn't happen except for very short periods of time. Okay? So, interesting thing about the interplay of your credit number, right? Which there are all sorts of ways that lenders calculate the credit number. So Credit Karma will give you a credit report number, okay, which is an average of the three in some kind of formulaic thing. Guaranteed, the particular lender, when you go and choose a lender, because you're probably not going to have cash to lay on your first house 100%, when you go to a lender, they have their own formula, okay? And so what you see as the kind of the published credit number will more than likely, the number that they use will be much less, okay? So if you have a 750 as a credit report number published, it'll probably be closer to 705, okay, when the lender gets through with you. And that drives interest, the interest rate. So, and what is interest rates? The higher the interest rate, the higher the, remember, investments and interest are very similar in that they measure risk. So the higher interest rate you receive means there's more risk to an investment. Okay, the higher interest rate you pay means that you're a riskier investment for the bank than some others, right? So the better your credit score number means that you are a lower risk. Yes, sir. And your interest rate will be lower. So the credit score number is inversely proportional to the rate that you pay, which means you're a better risk, right? Okay. So, in order to have an influence, you can have an influence on your credit report number and the one that they will use privately by keeping your credit balances. If you have a credit card, you should keep a balance of less than 1/3 of the total outstanding balance available to you. Okay, so less than 1/3. Okay. All right. Don't add any debt. So don't open any new lines of credit. Don't buy any big things like cars. Cars will torpedo your chances of getting a home loan if you buy them within a certain period of time. Okay. And then you're going to have a current employment status, but you also need to know where your down payment's going to come from. But new home buyers can put very little money down. Okay? But the less money you put down, the higher the risk, which means that'll drive interest rates too. Or, if you're not able to, through either your resources or your parents' or grandparents' resources, if you're not able to put down at least 20%, there are exceptions, and they do have new home buyers, and the percentage may be different on this. But banks, typically, if you're buying a house and you put down less than 20%, you have the privilege of buying insurance that insures the bank for if you walk away from that house and don't pay your debt off. Okay, it's called private mortgage insurance. It does not insure you, it insures the bank. So it limits the bank's risk. But you get the privilege of paying. Okay, so that's an extra monthly payment that you get to add to your already large payments. So you got to know where the money's coming from, and if you don't have the money to avoid private mortgage insurance, I would recommend that you defer your decision until you do. Okay. What that may mean is that you have to rent for another year. You may have to eat ramen for a lot longer in order to get that done. But you will live a happier life if you keep some of these simple principles. Okay. That is, have the cash to be able to pay for it without doing PMI, and being able to continue to be generous in your giving. Okay, so next page, I won't belabor all this. So you have to get ready for the down payment. We talked about that just a second ago. The funds you need to be able to get at them. Liquid means less than 3 days for a mortgage, okay? You typically won't close the same day, or closing means that, okay, if you're a seller, you get a check that comes into your bank account. That's what closing means. That means that the loan is funded. Okay, so if the sellee is taking out a loan, that means that they've cleared their bank's hurdles and they're a good risk, and the bank has found the cash to fund that mortgage and to give the seller a check. Likewise, the buyer gets to sign about 50 pages of documentation, which boils down to, yes, I know I have a debt, and yes, I promise to pay it. All right. You would think the lawyers could figure out, half a page document to be able to do that, but no, there's all sorts of things. So, in reality, if you're a buyer, plan to spend basically the whole day with the title company signing a bunch of stuff. Okay. And then the rest of it on that page just basically says if you have investments and stuff that you need to have good documentation for that, the lender will ask you for it all. Okay? All right. The next page talks about does it harm your credit score, FICO score. Again, each credit reporting agency has their own way of calculating that, and each lender will manipulate the ups and downs on that too. So the reality is that you think you know your score, but the reality is that it's calculated however they want to have it calculated. Okay. So the lender will pull. When the lender pulls a credit report, it does have an influence on your credit rating. However, if you do if you're shopping around for a lender and you pull multiple ones within, I think it's a week or 2 week period, then it only counts as one inquiry, even though you've got 4 different banks or 5 different banks pulling. All right, so that's something that you really want to be mindful of, because if you pull one and then you kind of have a falling out with the lender and you say, well, I'm just going to, find somebody else, and 3 weeks later you have them pull it again, now you've got 2. Okay? So my recommendation on that is find a small group of lenders you think you might like to work with, make some applications, and have them pull all your credit reports at the one time or within a similar, I think it's about a 2 week period, 10 days, 2 weeks.
So when we applied for loans, we should have just, I know I did it like 1 loan a week, like to see what they give me, like what percentage they give me.
Yeah.
So I should have done it like in 1 week, like just.
Yeah, because they'll only pull it one time.
Okay.
Yeah. It's not terrible. It's not a terrible thing, but it's 5 or 10 points.
Yeah.
Okay, so it's not going to hurt you terribly. All right, this gives you a breakdown. I'm not going to go. You can read it. Okay, that's a nice little graph on how that's calculated out. Okay, then we go through pre-approval. Okay, they're going to ask for proof of income. They're going to pull your credit report, and they're going to have proof of assets. That's pretty simple. This will take you a fair amount of time gathering that documentation together, though. So just plan that there is going to be probably a week's worth of time at nights when that's all you do. You pull bank statements, you're going to pull investment statements. Once you get to that point, you're going to ask your employer to do a proof of income, which will take a few days, especially if they don't have an accountant available. Many of you will probably work in small private practices, so that it will take a while to get those documentation. You can get it, it just takes a little while. Okay. So if you find a property and you come in with your hair on fire and say, I've got to close the next day, it will not happen. It won't happen. Because you got too many people having to do too many things to make that work. All right. And then it gives you some credit scores. Again, keep in mind that the published credit score will more than likely be 20 to 30 points higher than what your lender's calculation of your credit score will be. So just plan that accordingly. All right. So a pre-approval used to be a requirement if you wanted to get into some areas of California where there are situations in California and recently where buyers will offer more than what the asking price is. Okay, is that a bargain? Say no. So if you get in a situation where you get in a buyer's what I call feeding frenzy, think sharks. All right, step away, step back, and just think about it for a minute. Does that piece of property, do you have an emotional attachment to that property? Do you have to have that in order to live? If those answers are yes, then you might want to seek some other counsel before you make those decisions, because more than likely that the other buyers are in kind of an irrational situation, and you get to the point where it's less about what's best for you and your family and more about winning. And I would suggest that you step away from that, because there's a Greek word called hubris. You should look it up. It has all sorts of negative things that happen when you exercise hubris. Okay? Okay, so I'll let you read through some of the other details on that. Basically, getting it pre-approved, okay, good for 90 days. That does help when you're negotiating with some, if you know you're going to have to take a loan and you know that you have proof of funds for the down payment. Those documentations do help when you're negotiating with a buyer or a seller, rather. Sorry, because it proves that you have serious intent. Then they can really talk to you. So talk in a meaningful way. So if you want to go to a buyer and ask for 20% off the asking price, it would behoove you to have your funding ready and letters ready to go so they can inspect it, because from a seller's point of view, they want a quick close and they want as close to the asking price as they possibly can get. Okay, some will negotiate the asking price in order to have a quicker close. So that's your negotiation chip when you're looking at these things. That's all the seller worries about. There may be some emotional things that come along with that kind of tips the scale in your favor or somebody else's favor. But those two things typically, and I've bought and sold houses quite a bit. From a seller's point of view, how fast and how close to asking price. Okay. All right. So there's a laundry list of other things. Applications on getting pre-approvals are usually free. Credit checks. So while you can get credit reports for free, there's a much more detailed credit report that the lender gets that does cost some money. So your ballpark should be around $20 for that cost. And lenders should have established fees. So when you're shopping and you've got your small group of lenders you want to interview, all right, you should ask them for their fee schedules. Okay, that'll give you some perspective. If they're going to charge you $200 for a simple credit check, then I would walk away from them and be really concerned about what other fees they want to charge going forward as well. All right. Oh, this says actually 30 days. So 30 days, if you get multiple lenders within 30 days, then it only counts as one credit check. So my time frame was a little shorter than that. 30 days. Okay. Application doesn't bind you to a lender, so if you find that things aren't progressing as you expect them with your lender, then you can still walk away from it. All right. You can look at different financing options with pre-approval. It's valid as long as your finances don't change. So if you go out, if it's a 90-day clause that the pre-approval works, but you go out and buy a car at 45 days, guess what? You get to go back through that process again. Okay. All right. Types of loans. Okay, there's a conventional. Remember I told you that if you pay less than 20%, you get the, except for first-time home buyers where they change the percentage, I think it might be 10 down. You get the privilege of buying mortgage insurance, right? But conventional, you have a down payment and they're either fixed or adjustable. Okay, conforming or non-conforming means that there are federal loan guidelines. Conforming means that they conform or follow the federal guidelines. Non-conforming means that they don't. So, that demystifies that verbiage. Okay, there's an FHA loan. All right. If you go FHA, which requires the seller to go through a process of certification for those kinds of things, you have a much lower down payment, but you'll always have mortgage insurance. So if you
all houses qualify for that though, right?
That is correct. The seller has to go through a process of getting them certified through that process. Now, if you're a veteran, okay, you'll also have a VA guaranteed loan. Okay, you see some advertisements on that. You can even do reverse mortgages and stuff, which I don't recommend. The VA loans will allow for no down payment. That's just one of the federal guidelines and benefits of being a vet. Okay. And then a jumbo loan, I hope that you won't get into this situation until you're much more advanced in your financial future. Okay. Jumbo loan basically means you bought a huge house and you can't get the normal lending, so they go through a different process, and it's a non-conforming loan. There's more risk because you don't fit the cookie cutter mold, right? So you're going to have to put more money down, and they're going to be a lot pickier on how much debt you have, okay, and types of debt. So, but if you go with the jumbo loan, you're buying a big old house, right? If you're Kanye West or something like that, or Kim or whatever, then you have cash to do that. And so you're more than likely not going to get a loan unless you need it for tax purposes. And if you need it for tax Purposes and you're able to put that kind of cash, you need to go to find a good financial planner, all right? Because that's not the way to do it. Okay, and then there are mortgage rates, and this was a year ago. But oddly enough, they really haven't changed that much. Okay, we've had the terrific thing about having a growing but stable economy is that there are not a lot of economic jarring of the system. Okay, what does that mean? It basically means that interest rates stay about the same. Okay. So what you pay as risk-adjusted interest is about the same as you would have a year before, and actually it was a little better. The rates were a little better the year before that. I refinanced 2 years ago and got 3.75 for 15 year. Okay, so a little better, but not huge, right? And not like my parents. My parents bought their first, or my mom bought, I guess it was her second house, but first was my stepfather, in the early 1980s, and it was a seller financed, which means the seller held the paper or the promise to pay, right? And they thought they had won the lottery, and they did at that time. 13% interest. Okay. The mortgage lenders were running at about 17 or 18% for a house. So having low interest rates for housing has a lot to do with whether or not the price of that housing is able to increase or not. Right? When you pay interest to the bank that's up here, prices tend to flatten out. Okay, so you don't have appreciation, but as you guys have learned from the video, where do you get your money, your value out of that? It's at the buy, right? Because you can't count on appreciation in that case. Whereas rates are stable, and risk-adjusted rates are stable, now you have the opportunity in real estate to have a reasonable price increases for that, and then over the long term, over say 15 years, because you should shoot for a 15-year mortgage, not greater than that. At the end of your 15 years, you should have some price appreciation in that property, right? So even if the property's 15 years older, assuming you've done the required maintenance and upkeep on the house, you should have a better priced house that will, after inflation, yield some wealth improvements to you. All right. Okay, so types of lenders is a broker, a bank, and a direct lender. Okay. A broker it's like going to an insurance broker. They are able to go and look at many different companies and pick one that would work for you. Keep in mind that the brokers make money on this deal too, so it's not a pure self-disinterest on their part. They will steer you into products that they make money on too. All right, but at least you both will win in that process. A broker, however, has less control over underwriting. So underwriting are the actuaries or accountants that sit in the back room and determine what their risk is for you, and whether you should have 3 or 6 basis points, which is not 1%, but it's a 0.1% is a basis point. All right, so it's out to the 100th place if you take the percentage sign off. So the accountants and or actuaries in the back room determine what your interest rate's going to actually be. Okay, as well as what other documentation, as well as how fast they work. So a broker doesn't have any control over that. They're simply throwing this information to that external company. Okay, a bank has more control over the timing, but a lot of times, because the banks are so large, they're doing so many deals, the paperwork gets backed up, right? So you can imagine seeing 12 patients in a day and how that might impact your productivity, and that's kind of where they are at that point too. And then a direct lender is kind of the best of both worlds. They have their own products, they control the underwriters. All right, there aren't many of them out there. They typically will go in with their own money or investors' money. Okay, so if you flip then to the next, comparing GFE results, good faith estimate results. Okay, that's where shopping for banks is helpful. They'll give you a good faith estimate, which is basically they'll give you an estimate of all the costs that they think will come your way, and it's in a standard form, so you can put 3 or more lenders' pages side by side. And then some places you'll win, some places you'll lose, and you'll just have to make a educated guess on all that. So it gives you a couple of things. So discounted origination points, interest rates, insurance premiums, and the APR. All right. We didn't discuss discount origination points. So let's say your risk-adjusted interest will be 5%. Okay. A lender may come back to you and say, well, if you pay 1% of the entire loan, so if you take out $100,000, right, 1% of the $100,000 up front, okay? So in addition to your down payment, if you pay another 1% up front, will make your interest rate 4.5% over the life of the loan. All right. Well, you need to look at that, because 4.5% compounded over 15 years is some fairly big changes. Okay. tax-wise, you can deduct those points in the year in which you pay them. Okay, so that makes some sense from a tax standpoint, right? However, if you think that you may be buying this house to sell it in 4 or 5 years, the trade-off may not be very good for you. Okay, because you're paying interest up front to buy down future interest payments. And there is a break even on this, and you can go out and there are some nice lender tools that you can go on that were online and you can calculate that out to see if that makes sense for you. If you're planning to hold the property for 15 years and you know you're never going to move, or if you do, you're going to rent it out, okay, it may make sense to buy down the interest rate, okay, because of the compounding aspect. But you're going to have to make a decision, and you should make it in advance so that you and your significant other should say, well, we're going to be in this for probably 7 years. Run the numbers, and if it's marginally advantageous, I would say steer clear of it. Okay, it should be a significant savings if you're going to pay money up front, because you're going to lose the time value of money of that money that you could have put into a mutual fund or what have you. It may be your savings, all the savings that you had, to make sure that you've got the 3 to 6 months, or it could have an influence on making your investments. So if it's only a marginal improvement, I would just say it's just not worth it. Okay. Okay. And it gives you a recap. It's not my recap. So I borrowed this heavily from a mortgage broker friend of mine. And he said I could use it. So. Any questions? Probably lots. Yes, sir.
So what happens if you're like still in the middle of the loan, but you have to move somewhere, so you want to sell the property before the loan is paid off?
Sure. So you have full right to sell that property. So it's not like leasing a car where you have to go back to the car leasing agency and beg for their permission to sell the car. No, it's your property, you can sell it. The bank simply holds a lien on it. Once you sell it, then and you close, then the buyer's financing, however that works, will put money in with the closing agency, and the closing agency will write a check to your bank for whatever you owe. So when you go through this process, the closing agency, usually a title company, and I'll talk about that in a second, usually the title company will reach out to your bank, because that's part of their due diligence, and say, give me a guaranteed payoff amount, right? And if you close within that, the time period in which that pay amount is valid for, then that's the check they'll cut. Otherwise, they'll ask for another one to do it again, because sometimes the buyers have issues that get delayed in the closing. Okay, anything that's over and above that you sold the property for, they give you a check. Okay. Title company, this is a sweet racket. And I hope have you guys ever heard of blockchain? It's been a lot of No? None of you? Okay. Well, there's technology out there called blockchain that basically it's a way to guarantee a transaction between two parties. Okay. If we had this technology, we would never again need any title companies once the original research is done. And title companies work this way. Okay. Way back when, nobody owned any property here, right, in California. And then the gold rush came in, and people staked their claim, right? Right? And then they either died or passed on that claim to somebody else, right? And but there wasn't anybody to validate the claim, right? So a title company validates the claim that the person who owned it and the person who wants to buy it or inherit it have rights that they're transitioning from one to the other. Okay, so a title company does the research. So you can imagine that if it passes through 100 different people's hands, they would need to know kind of that the title and rights. It's really rights to use and own the property and the mineral that's underneath, etc. That rights pass what the term I use is unencumbered, which means that nobody else has conflicting rights to that. That's what a title company does. Sounds like pretty boring work, but I tell you what, they make a mint. Why do they do that? Because every time that property changes hands, they get paid to do the same research they already did again. Okay? And so you build up a big bank of research and you charge them this much amount of money for this amount of work, and that's a terrific annuity or continuing payment that comes to the title company every time that title passes. So what blockchain would do is cut them completely out of the deal. Now they do offer some other services, clothing services, which basically means they receive funds in and they cut checks. It sounds like a bank, and I think your bank does it for about $20. They charge tens of thousands of dollars to do this kind of work. So it's crazy. So I'm hoping that blockchain will come and fix that whole issue. It works in all kinds of transactions, buying, selling cars, wherever there's a buyer and a seller in a meeting, an agreement. Okay, those things can be validated electronically instead of having to do the research every time. But that title company will act as kind of the intermediary and banker, etc., for all of these papers. Remember, the buyer gets to sign 50 pages of documents and the seller walks out with a check. So it's really kind of unfair, but that's the way it works. Any other questions? With any of these things, the first bit is to have a budget, know what you can spend and what you're willing to spend, practice some good negotiation skills, do the paperwork up front, find some good partners that know what they're doing in terms of banking and etc. You can consider going through a real estate broker as well. They will have some expertise in the markets, etc. But nothing. You will pay more for leveraging somebody else's knowledge and education than if you did the research yourself. Okay, so if you have the ingenuity and the spunk to go and do some research on your own and seek the advice of professionals, but not expecting them to do all the work, then you will more than likely retain more of the financial benefits than if you turned it all over to somebody else. That's a good rule of thumb for any transactional thing. So if you're willing to mow the lawn yourself and then have the tree trimmer come out and do just the tree trimming, then you're going to more than likely pay a lot less of your wealth out for lawn care and yard care than if you have them do the whole kit and caboodle. But if you don't like to do that kind of work and you have the cash and you're happier to do something else, go for it. All right. What other questions?
Did you recommend it to get a 15-year fixed loan? I know, like, in the long run, you will pay more if you get a 30-year fixed loan, but don't you think, like, I just think about inflation and, like, thinking that most likely the house will cost more in like 30 years.
Yeah.
So don't you think it's better to get a 30-year-old loan so you can just like get lower monthly payments and I don't know. Just my thoughts.
Sure. Well, anytime you stretch out the payments, as long as the interest rate isn't following too much along with that, you're going to pay less. All right? And if that's your strategy for getting into a house and moving along, then I'm not faulting anybody for that decision. I've made those decisions before. If you are disciplined enough to take the difference in what you would have paid at a 15-year rate and put that into savings, okay, you will be much better off. Okay. The reality is, for me, is that life happens. I've got 4 kids, and it just feels like I'm just every morning just pulling out the 20s. Here you go. Here you go. Here you go. Here you go. And so cash just flies out of the house. So one thing that I have done is my wife and I did a 15-year, I think I mentioned 3.75 interest rate, and it forces us to have to make those payments, so it's no longer an option. But I would eventually like to retire, and I'd like to retire with my house paid off. And so the strategy, at least at this point that we've chosen, is that by the time I'm retirement age, then the house will be paid off. All right. So that's the nice thing about the financial markets, is that they have many tools to fit where you want to go. All right. And again, remember I said, don't just trust the Burdick Ramsey show. Go out and do your podcasts and that kind of thing. All right. Dave's perspective is get out of debt as fast as you stinking can. And one of the strategies is to not take too much of a loan for your house and pay it off within 15 years. You can pay it off in 10. Okay, the interest rate gets a little wonky, but if that's not how your plan works, then I would just recommend again, you're going to have a great budget coming out at the end of this project. You're going to have some understanding about how to make investment decisions, all right, and understand yourself on how you weigh the pros and the cons for that. And then I would just say, pick a strategy and stick with it, and take the tortoise approach, okay? And just, unless something completely goes askew and is completely out of what you'd expected, slow and steady wins the race. So if you want to do 30, do a 30. Just be deliberate about the other aspects of your budget, which include savings and charity and those kinds of things. Okay. What else? All right, so you got chapel today probably. Go in peace. Thank you.
Thank you.
For that
Oh, I need the sign-in sheet, please.
For the monthly cash flow assignment, it flew past my radar. I have excuses. I know you don't want to hear them, but can I still turn this one in to you and get your feedback?
Yeah, that's fine. Send me an e-copy of it.
Okay.
But then
for being on my side as
but then your monthly payments are gonna
you know what I mean?
Yeah, 20% down.
They they supported me at every moment in my friends and my and I'm trying to do this part because what is later because I really want to put it together but it's not I'll finish it later. I have to
I'll see you. Let me know how it goes. You have the results the next day, right? Yeah. Alright.
Are you going to go?
It's the last chapter.
Okay, we'll go with
I'll text you guys when I'm done.
Yeah.
Do it.
You're gonna pass.
Study and stuff, I guess.
Practice. Because last year, I think I saw them thorny in their morning and night. And then I had to try it.
Yeah, I live right here.
Yeah, well, delivery, that was another.
So if we're under 100, if we're under 200, we're just gonna order 2 and get 200. But if so we're under 200 and people have more roses, then they can get even more. But it looks like this looks pretty good, especially the individually wrapped ones.
Yeah.
Because that would be so much easier, like these. So we don't have to do.
Oh, yeah, so we don't have to do anything.
The other ones came in a big bulk. The other
a lot
ones,
better.
yeah, came in a big bulk like this, but they weren't wrapped.
Oh, that's what
And not deep-thorn. I was like, I don't know how to do there. Barbara has this deep-thorn, and she's like, but we're spending so much time doing that. So we're gonna do this.
Our seniors were in their own morning too.
Yeah, and that's why I was like so stressed. I was like, I don't want it
because we have the money to actually get something like this.
Yeah.
They went on a senior trip.
Yeah. So
might as well use it to the advantage.
might as well use this to our advantage, and then we're giving 300 each to Barbara and Jeanette. Honestly, Sean, from my honest opinion and from a couple other people, we could ask. I think we should ask Barbara what she likes to do.
Yeah.
If she wants a coffee machine, we should do that. But some people are weird with their coffee. They're like they like their own individual machine. You know, like some people don't like the Keurig. Some people don't want the fancy coffee. So I feel like we should ask.
Yeah.
And if she wants the fancy coffee machine, then yes, like let's do it. But if she doesn't,
So,
yeah, you know what I mean?
more thankful someone can go and probe around
I think
without giving it away.
Cynthia is going upstairs and figuring out some things. And then Barbara's going to be back at 1, and I have to talk with Barbara anyways. So I don't know. We'll figure it out. but this stuff is giving me a headache. Like, it needs to be sober. Three? Okay. Just let me know for sure by tomorrow.
The DES program, which probably just gonna.
And I feel like we're gonna have an extra anyways if we don't go over, because we need, like, we can only order them in hundreds. So we get 2 orders, so 200 anyway. Alrighty.
Or we can make a bouquet and give it to. We have the extra ones, we can make a bouquet and give it to.
Yeah, or the instructors.
Yeah.
Or something like that.
Yeah.
Okay.
That's a lot of inspectors to go through.
I know, right? Okay, we'll figure it out. Do you want to go to the MedCap real quick?
I'm skipping.
Because I'm eating lunch.
Yeah.
Or I can go with you though.
Let's go to the fifth floor and see if they're out there and if we can start early.
Where's you want to get a burrito?
Well, they don't open until 4.
Yeah.
What was this class even about?
Investments, all kinds of investment, real estate, how to get loans and stuff.
Yeah, I haven't been paying attention.
Things you, I guess it's things you start thinking about after a while.
Okay.
I don't know. For the first few years of working, I imagine I'd be renting. So.
Yeah.
Yeah, so that's a little far off.
Yeah. Alright, thanks for your help today, Sean.
No problem.
It's so hard to please everyone in the class.
Oh my goodness.
Like, you guys
I have a good job.
Thanks. I've come to the conclusion that not everyone's gonna like me, and they're just gonna have to deal with what I'm doing.
We'll go with the consensus. If you don't go with consensus, then go figure.
So, alright.
Everyone. Someone's always gonna have a problem.
Okay. Should we just wait in the lounge? Sure.
Hey Dan, I'm on the screen that says logging in and it's spinning. You want me to reboot the system?
Okay, so I'm going to get rid of that. Okay, give me 1 second. I'll just something code here.
You know when I told you that it keeps logging in? It did for the whole weekend. Monday we came and
So it just never went away. So it never timed out.
never timed out.
Never timed out. Okay. Let me see what I can find here. Just give me 1 second. I'll just get all the code to this uploaded.
Test. And the volume control somehow got changed. Like right now, I'm talking, I can barely hear it. Maybe because the control is not well, I don't know, I can't see the control right now.
Yeah, let me, 56.